philosophy. You can actually philosophize a lot about the health effects and benefits. So look forward to the presentation of Professor Dr. Wolfgang Kemmler. Thanks very much for the kind introduction. I simply wanted to go online quickly. A short while ago, we had the statement of the German Society, the Deutsche Gesellschaft for, let me look it up quickly, for medical imaging or physical imaging, physiology. I was really annoyed when I read it, to be perfectly honest. The upshot was EMS training is not suitable to be fit comfortably. Yes, we agree. It mustn't be comfortable. But they carry on. The training effect is not a proven one. And with wrong application, the method is even risky. I have to deny the middle part of it. Of course it is efficient. We want to talk about the scientific evidence and the effectivity. And you can read it out of studies, if you can read studies right. My focal themes today are the fitness and health effects, the health and fitness-oriented effects of a whole-body EMS training for non-athletic cohorts, including sports students. I usually focus on the classical audience for you, older people. Very often these people couldn't throw standard strength or endurance training. Of course, muscle mass can be built and back pain can be treated, but the cardiometabolic magnitudes, we know that with whole body EMSS, we can impact visceral fat and body fat. This is a classical cardiometabolic magnitude that has to do with blood fats, with high blood pressure. So we do have a possibility to use whole body EMSS. So we have clear evidence for this. Then endurance and performance. My colleague Zinner, esteemed colleague Zinner, already talked about this. And we really took a very scientific approach. And I want to take you by the hand and walk you through the systematic review. You first actually go through, browse all of the literature, then conclude the efficiency. To simply say that there is no effects produced, this is very unscientific, and this is why I was extremely upset when I read these opinions. How do I do such a systematic review? Well, you identify studies based on databases. You won't be able to read this. Medline PubMed, you will be familiar with this database, but there are also other databases where you enter the search terms like whole body EMS, cardiometabolic factors, and you identify the corresponding studies. That's easy to do. This is an easy process. You search all of the databases, and through the research and the studies found, you do secondary research, predominantly German literature, which is, of course, hard to find in international databases. After the first round of browsing, you will have, of course, redundant studies, double studies. Then you look for titles. Some are wrong hits. But at the end of the day, there are 23 studies for whole body EMS, and this is quite a lot for health effects. So there are 23 reliable studies available. And these are the studies. You don't have to read all of this. I won't walk you through. These are the studies available. The drawback today is that we in Germany, our working group is unfortunately almost the only one really dealing with this topic, addressing this issue. And we get questions, well, have these studies ever been verified by other working groups, by other scientists? This is of course a very justified question. We would therefore be delighted to get some competition from other working groups. Let's look at the individual topics. First of all, muscle mass. For older people, this of course also means sarcopenia. Sarcopenia is a new type of disease, or listed as a new disease in the 60s in the CD code. This is a loss of muscle mass and the loss of functional abilities related to muscles. So these are the studies, the authors. I'll take you by the hand, as I said before. First of all, have people stayed on the training or have they dropped out? 90% actually dropped out. No, it was not that case. You can see very nice figures here. And that shows that our training is very sustainable. People stay on board. There's always the difference shown between the trained subjects, a group of trained subjects, and a control group. So there's always a control group included, and always look at the effect. And this means the difference between the trained subjects and the control group. That's very easy when you do it scientifically. Then you've got the p-value. It's strange at times because it means the probability that allows me to say A is higher than bigger. And we always assume 5%. And this is like the rule, the golden rule, the rule of thumb. But what is more interesting for us is the SMD, the standard mean difference. Mr. Zinner already presented this number. So regardless of the number of cases, of the number of subjects, this is the difference between the trained subject group and the control group. Until 0.3 would be insignificant, 3 to 5 is a medium effect, a medium to good effect, and above 7 is an excellent effect, just for you to know. So you can rate all of this. Here, the training type across all of the various disciplines. Excellent effect, excellent effect. For lean body mass, so the total fat-free mass, which is muscle mass. In the trunk, of course, have organs. Then the ASSM is the appendicular skeletal muscle mass. This is arms and legs, because here you can count out the organs. But all in all, very good results. But here, bone density was included, because musculoskeletal also means bones. And as good as the effects produced on the muscles are, unfortunately, the bone density and the risk of osteoporosis is not impacted, unfortunately. So lumbar vertebral column, which is a classical application, so there's unfortunately no effect. Maybe 1 year is not enough to measure the effects, but this is an important message for you. So it is not suitable for people with osteoporosis. It's better than nothing, like a whole body vibration, but what is missing is the impact, the vibration, because bones react to this. Here, there's another peak. We compared whole body EMS with HIIT training, plus, so full load, full exertion training. And there, the HIIT training was better, slightly better than whole body EMS training. I would have expected this, but fact is, in terms of the volume, you have to spend 3 times the amount of time for HIIT training instead of EMS training. It sounds sexist, but especially women and older people don't feel like training to full exertion under full load. The effects are very nice, but compared to or with HIIT, it of course fares a little worse. But overall, you can say that muscle mass is excellently impacted by whole body EMS. And our studies run between 16 weeks to 1 year to the growth, muscle growth with up to 1 kilogram. They will laugh at this next door, but we're talking about older people, and this is a huge, huge amount for older people. It keeps them self-sufficient. It keeps them independent. On muscle power and muscle function now, that's the next factor. And we worked with a leg press predominantly. So LP means a leg press, and there we measured the strength, the power, and evaluated it using a leg press. And we come up with comparable values. In comparison, again, excellent values for whole body EMS on regarding strength and power. And power is more important than maximum strength for older people. Acceleration is so important for older people because the fast twitch muscle fibers are actually decomposing and retarding as you grow older. So when you look at this image here, in conclusion, looking at the effects, you could say that it is very good. Also striking, you can see the comparison between whole body EMS and HIIT training, conventional HIIT training. And in the area of dynamic muscles, HIIT training is a dynamic strength training, and it actually produces better effects. But when you look at the holding muscles that is classically affected by whole body EMS, the better results are negligible for a HIIT. Very impressive, these figures. So high effects up to excellent effects. And one more thing I would like to add, adverse effect. This means the undesirable side effects. Somebody collapsed, or somebody suffered from vertigo, or did anybody have extremely high CK value? No, there was no undesirable side effects. All of these studies have not produced any of these undesirable side effects. So they're not only effective, but EMS, whole body EMS training is also safe. What about back pain now? These are some individual studies made by Mr. Fritsche from the Bergwerens working group. Then there was one meta-analysis done by us where we actually evaluated all of the available studies and actually extrapolated the results of 4 studies, then a nice study by Jens Vatter, and one study by Anja Weißenfels, my colleague, who will present tomorrow. All are clearly above 0.7, so a very good effect on back pain as well. Jens Vatter actually came up with the best results with an SMD of above 1, which is fantastic. So in retrospect, we have clear proof that whole body EMS actually impacts back pain positively. So we had in one case unspecific back pain, and in another case it was sporadic back pain. So the effects are proven not only for muscle mass, muscle function, but also for chronic and unspecific back pain. This is the classic disorder, and 3/4 of our population actually suffers from this. But Anja Weißenfels will actually drill a little deeper there. Then cardiometabolic risk. This is interesting to me. You usually focus on muscle mass, and when you look at a strength-focused training type like EMS. But we found that in most of our studies, more fat was reduced than muscle mass was increased. So you had a neutral BMI after the neutral weight after the study. This is interesting. Body fat is, of course, a risk magnitude for cardiometabolic risks like alpoplex, diabetes, this triad of cardiometabolic diseases or disorders. Talking about fat, visceral fat is of particular importance. Belly fat or visceral fat means this is the intra-abdominal fat inside your belly. So visceral fat means between your organs. And this is regarded as a very high risk factor. Waist circumference correlates with visceral fat to a high extent. And here again, you can see excellent, outstanding correlations. There's one exemption. That's an interesting study. In this study, we included very old people, very low in performance, and we actually allowed them to move their arms and legs, and they were lying. And they were only trained once a week with a very low intensity. And strangely enough, beautiful effects on the muscle mass, but no effect on the body fat. We don't know yet. I would have expected it to be the other way around, but it wasn't. But all in all, very, very helpful data. Again, some peaks here, and I can't account for these. It was a study by Van Buren involving patients with chronic heart failure, so the heart rate was very low, and it was a short study, 6 weeks only. Maybe they should have continued for some more time. In summary, again, the effects are very evident. When I follow a proper training protocol, then we can produce proven effects. So I really wonder how people can ever say that we have no proof of the effects. Let's actually drill down a little deeper into the cardiometabolic risk factors, and I want to focus on the Van Buren study in particular. This involved people with a chronic heart failure, with a heart insufficiency at the end of the day, very fragile subjects. And we looked at the heart rate, and in fact, the rate, the output rate, which is of course so important, was increased by 13%, and this is spectacular. They always compared whole body EMS with local EMS applications. So they had no zero cohort. And this is why the results are all the more interesting. Beautiful data. We know that EMS, whole body EMS, can't do everything, but this data is really very encouraging. Again, colleague of mine, cardiometabolic risks, high cholesterol, high glucose, high waist circumference, and again, a very nice change of the risk factors. Again, a satisfactory result, not spectacular. I would have expected this with cardiometabolic risk factors, but it is quite impressive. Quite as good as strength training, multiple set strength training, which of course requires more time, no doubt about it. Endurance, well, this was already explained by a colleague at Zinner, and this is why I can skip this one. Endurance, in my opinion, if I only want to do classical whole body EMS, then this will hardly impact endurance. Maybe V2 max. Yes, that's a big difference. Don't get confused. V2 max, I get this activation through a higher muscle mass. But the classical endurance time until stop of performance cannot be improved with whole body EMS unless I use a bicycle. You have to accept this, which is normal. Who would expect to use strength training to improve endurance? So these are clearly the limits to EMS training. This is only natural. Current evidence in terms of effects, so proven effects. So this is the evidence. This is the word is really loved by the Americans. So we know that there's a high effectivity for muscle mass, for the abdominal and overall body fat. Then it is a power-induced training type. So the dynamic power and isometric power is improved versus the local EMS application. Then there's a clear effectivity proven for back pain and the quality of life and the physical self-appreciation. People, of course, feel better afterwards, having more power. This is natural for any type of training. But again, this plays a role for the quality of life. Then, moderate effectiveness could be proven for cardiometabolic risk factors. Not as good as for the muscles. Bone density, well, for lumbar, yes, but for the rest, no. And you always have to compare. This is a group that usually wouldn't do anything. They wouldn't undergo HIIT training, alternatively. So there is a moderate effectiveness compared to 0. Then incontinence, we did not study this. This did the FATA group twice, and they found a moderate incontinence effectiveness. This is, of course, a question of the training, how the instructor helps you. It is really important to be well supervised. This is always important, but in this particular case, you should probably switch over to a one-on-one situation. Low effectiveness on endurance, if at all. These are the limits to this type of training. Why use with even applying a HIIT training to full exertion, you wouldn't be able to improve endurance. Then there's no proven effectiveness for mental performance. Well, we didn't expect this. And there is very low or little evidence for mobility and flexibility. This is a power-induced type of training, so it won't actually really impact mobility and flexibility, which is normal. It's a type of training that really focuses on power, muscles, the cardiometabolic risk, but does not really focus on flexibility, endurance. These are clearly the limits to EMS applications. Well, then, in summary, whole body EMS is an efficient and effective training method if I select the right targets. It is, of course, not an option for sports people that rely on endurance. Then there's another benefit associated with the whole body EMS. It is very joint saving type of training. It is a wonderful alternative to conventional strength training, and this is why you should focus on the groups that already have joint problems and limitations in this area. This is very, very rewarding for you. Then, when you really execute the training properly, if you take the contraindication into consideration and follow the relevant guidelines or regulations, then whole body EMS is actually not a risk whatsoever from the health point of view. As a summary, we could say that whole body EMS is the choice for people who don't want to opt for classical power training or who can no longer go for classical power training or strength training. So this is 2/3 of the market. And a very clear limitation here, all of these studies were made under very close supervision. So if you actually train 10 people at the same time, like with Mia Botetek over there, then this is, of course, not what we did in the study. I don't know. I couldn't say that the PC ball had the same effects, but I am really sure that a big effect was also can also be attributed to the close supervision, which means one personal trainer and two trained subjects. And this is why we see the use of whole body EMS only in the setting of a max extended personal training, 1-2 with 2. And only then it's considered safe. Thanks very much for your attention. We as researchers are not subject to any conflicts of interest here. And I would like to thank you for listening, and I am, of course, available for questions.